theoretically you can fix it, usually brought on by an acute precipitating event. This is 90+% of all hepatic encephalopathy. The other 5 to 10% are people who just have a further decline in their underlying hepatic function. And so again, diagnosis, the most sensitive indicators are, number one, that number connection test, then subtle behavioral changes, then asterixis, and ammonia levels are not reliable.
So does he ever end up needing a liver transplant? I know there was a lot of talk about it.
He's working on getting on the list. Yeah, he has to get out and be home and be stable long enough so he can even go to clinic and start his workup, which takes about 6 months. So I just threw this up there so that people appreciate just how bad stage 4 encephalopathy is. This is every bit as bad as a head bleed with increased intracerebral pressure. There's an 82% 30-day mortality if you don't fix it. And with stage 3, a 58% 30-day mortality. So that, you know, that's pretty hefty, right? Like, you don't want to leave, the odds are high. And then again, possible causes, which you all have on your sheet: dehydration, electrolytes, GA bleeding drugs, etc. Treatment, treat the underlying cause, lactulose plus rifaximin as augmentation, but not as a solo agent. And make sure you send them out on prophylaxis. Questions?
So if you're given lactulose and you're
Yes.
got a lot of poop going on and you give rifaximin, the rifaximin is not just washed out?
Amazingly, it's absorbed quickly enough that you do see clinical improvement even if someone's having 6 stools a day.
So what if they cut down to 2 stools a day? You cut the rifaximin down?
I think usually people would rather have less diarrhea in the same clinical effect. So I think if they can afford the rifaximin, there was the initial rifaximin study that was kind of poorly done suggested that a dose lower than 400 milligrams 3 times a day wasn't good enough. Had no clinical
conceivably
effect.
take them off the lactulose and just leave them on the rifaximin?
Or you cut their lactulose down, but then you leave them on the rifaximin. So should we try that number connection test, guys, just so you can see how it goes? These are also fun in the post-drinking game or post-call period where you've been up for a lot of hours. You notice the encephalopathy nomogram looks a lot like stages of being drunk before you pass out. Okay, guys, so I gave you all the same test. Don't start yet.
Hands up when you finish so we can see who's
Okay, we're
last.
going to start in 5 seconds, okay? You're going to get 30 seconds. Ready, set, go. Oh, check you two out.
30 seconds.
The PTs are all winning.
30 seconds, 35.
5 seconds. 4 seconds. 3
40.
seconds. Done.
45.
Anyone who's not done is encephalopathic.
Get the rectal tube ready. And so just so you know, when you go to transplant clinic, they make you do one of these every time you show up to pre-transplant clinic, and there's about 10 different random things, so you can't memorize by muscle memory what the order is, because the numbers are all different. It's a little bit evil, I thought. All right, guys. Any questions?
Thanks for coming.
Yeah.
Any questions?
Yeah.
I just had when I was out in another setting, not here in view,
Yeah.
a lady came into the hospital with a history of alcoholic hepatitis and cirrhosis. And so she actually walked in with her husband, and I was totally unprepared for how quickly she deteriorated. And it was like within a couple of hours, she was stage 3, and then she became comatose within about a matter of 4 hours. And this is out in a rural setting where we don't have an ICU or any of that stuff. And you know, trying to treat her medically the way the protocol goes, she began to ooze through her, you know, and bleed through her mucosa. So it was just like we just had to get her out. But the change in status was really profound. She went from talking to me and walking in to just,
Done.
Yeah.
Oh my God. And I think that is one of the take-homes here. It can be really rapid. The decline can be profoundly rapid. And people either kind of dwindle, or they just bang, fall off the edge of the precipice. And then you have a very short defined period of time where you can try to fix them before you have to do things like intubate them to protect their airway. Yeah, absolutely. And we didn't talk, there's a whole, because I knew it would take too much time, there's a whole other subset of literature about, so septic people who have end-stage liver disease, because sepsis is a pre-existing independent predictor of decreased mental status, and people with decreased mental status and sepsis, it's an independent predictor of death. But things like, what do you do with an intubated patient? So they have all these extra benzo-like receptors in their brain. They're almost already sedated, so they're profoundly sensitive to benzos. And this is like our every Alcat patient who comes in who's still drinking, or end-stage liver disease, but they're still drinking.
You stop the receptor up and they're sedated for about a week.
So there's data, which is sort of scary to me, but there are actually new recommendations out there from the Acute Hepatic Failure Study Group that say you should withhold benzos, and if you need a sedating agent or drips, you should use propofol and fentanyl, because propofol is theoretically metabolized. Its hepatic component of metabolism is done by a system that's not benzo related, and that's apparently relatively better preserved than some of the P450 stuff. I don't know, I think it's interesting. And that if they're on the floor and they get agitated and thrashy, and what do you do with a guy who's like,
Yeah.
you don't give Ativan and you give Haldol, and if they seize, well, they seize. Which seems a little bit scary to me, but that Haldol and restraints is their recommendation. And no Ativan.
Just true, it hangs around forever.
Yeah, but I think the jury's still on that. But it is true, right? Because how many people do, we give 2 doses of Ativan to, and it takes them 3 days to wake back up. Little miss, I need to get, deloused every time I come in, is like that, right? And her cousin?
and me.
Well, that one too.
Yeah.
Yeah, there's enough.
All right, guys, well, we are officially done.
Thanks for coming.
Can we give her a hand for being here today and stuff like that?
Thanks for staying awake. I'm sorry it wasn't loud with lots of sound effects, but.